So welcome everybody. This is an adhesion webinar. It's brought to you by Clear Passage. I am an employee of Clear Passage and I am a physical therapist. So who am I? So first, that lady with the long hair is me. Yes, I had my hair cut early December and I have yet to get a new headshot. So my name is Sharon Hepburn. I am a physical therapist and a licensed massage therapist. I graduated way back when in 92 from PT school, which is over 30 years ago. I graduated massage school over 25 years ago. I have a lot of manual experience, over 20,000 hours, and I have an additional 100 hours of training under Larry and Belinda Wern. So what does all this mean? It just means that I have a really clear understanding of tissue, adhesions, and I'm an expert in manual therapy and soft tissue. On that note, I'm also the Chief Operating Officer of Clear Passage Therapies. So what are adhesions? Adhesions are internal scars that are like tiny little straitjackets. They are just binding everything together. It limits organ mobility, motility, and function. So what does this mean in actual layman's terms? What it means is our organs are supposed to be gliding on each other like nice, warm spaghetti noodles. So scar tissues is an absolute must of the healing process. It happens anytime we have an injury. But when we have excessive inflammation, such as more surgeries, infections, trauma, radiation damage, more and more scar tissue form. And so adhesions start to form, this binding of the organs. So I'm going to go ahead and stop my screen share. So when we have adhesions, it's very limiting. Fascia forms around everything. It forms around every muscle, every nerve, every bone, every organ. So this fascia is where our scar tissues are can form in. So if I have an adhesion, and we're just going to go ahead, I'm going to stand up so you can see. If I have an adhesion, say at my hip, the scar tissue, it could pull at the hip, but can you see how it's pulling up? It could pull up into my shoulder. It could pull into my other hip. It could pull into my back. It could pull up into my neck. So these adhesions are three-dimensional, and they're starting to bound everything down. So now we have one adhesion here from surgery and one adhesion here from an infection. All of a sudden, all of this can start to get bounded down. Diagnoses that have adhesions associated with them. So bowel obstructions, which is this first slide here, show adhesions. You can see a bowel obstruction. Food is stopping coming through here. And after therapy, that bowel obstruction is very much open. We cannot treat all bowel obstructions because some bowel obstructions are due to tumors and some bowel obstructions are due to intercessions where that bowel comes up inside the top part of the bowel. But most bowel obstructions are caused by adhesions, and any bowel obstruction that is caused by adhesion we can treat. This next one is blocked fallopian tubes. So you can see on this picture, there is no spillage along the fallopian tube, no dye coming out. And in this picture, there is dye coming out after treatment because we've opened that blockage. We have a 69% rate of opening blocked fallopian tubes. That's just as good as surgery, and it's not surgically involved. So the chances of them remaining open stays better. We also work with adenomyosis. So adenomyosis is when there is adhesions inside the uterus. So do you see how this uterus on this picture is really thin? After treatment, it's opened up. It's more pliable, and it looks like it would be easier to have an egg either naturally or with IVF implant in there. Chronic pain, a lot of, oh gosh, radiation, injuries, old football injuries, just create a lot of scar tissue, and it really messes with our biomechanical function. I've had people come in after therapy, and they're actually taller after therapy. We can help with endometriosis, which is a disease process, and small intestinal bacteria overgrowth. So, small intestinal bacteria overgrowth is you have a bacteria in your large intestines. Once it gets into your small intestines and proliferates there, it's not good for that small intestines. Typical treatment consists of an antibiotic, which usually really works well. If you have recurrent SIBO, we believe it's because that SIBO has buried into scar tissue and is protected from that antibiotic. So with treatment, what we do is we're opening up the scar tissue, these adhesions, and allowing the SIBO to rear its head, and you're still going to be on a antibiotic or an antimicrobial, which will help then get rid of all of that SIBO. Okay, so do I have adhesions? Most everybody has adhesions, but not every adhesion causes issues. So even when people leave treatment, they're like, do I need to come back? Am I still tight? And I'm like, if you are functional, there is no reason why we need to have therapy. But if you're not functional, then come back. Or if you're not functional, seek a way to have your adhesions broken up. If you have black fallopian tubes, you have adhesions. If you have endometriosis, you have adhesions, especially if you have real painful periods, real painful intercourse, um, trouble with digestion, bowel obstructions. Most bowel obstructions are adhesion related, but caveat, can't treat tumors because I can't um, do anything for you on that, and I can't treat intercessions where that bowel comes up inside each other. Surgeries, even C-sections and hysterectomies have adhesions with it. Now, does every C-section and hysterectomy need to get therapy? Nope. It's when you're dysfunctional, painful intercourse, painful periods, low back pain, problems with digestion. Radiation therapy is another thing that can cause adhesions. So if you want to, put your hands on your tummy, preferably on skin. And if you just kind of push, it might feel nice and soft. But on those people who have adhesions, multiple surgeries, it will start to feel really, really tight, and I won't be able to push from side to side. It will be very limited. I'll get a little bit of a push, but not a big push, or it will feel really tight. Um, I've seen somebody who's had 24 abdominal surgeries, and their skin, their actual skin felt like a leather football or a leather basketball because were so adhered. So there are certain stretches, anything that's going to stretch my abdomen that will help with adhesions. The goal is to stretch out the skin that I was telling you about where you actually have an incision. It is also stretching out the viscera or your organs and helping keeping them mobile, and actually also helping with um, the scar itself. If you have an incision, the scar itself. So the first stretch is just propping up on your elbows and stretching out that whole front of you. If you do not feel a stretch like this, you can then extend your elbows so they're nice and long, and you definitely will feel a stretch even if you don't have adhesions. Most people who have some sort of abdominal scarring or adhesions, this in itself is very, very stretchy and feels great. The next one is lying over a ball. Do you see how straight that person is? As gravity starts to pull you over that ball, you'll actually start to get more and more of a stretch throughout your thoracic. And then as you work up over the ball with that ball underneath your hips, you're going to start getting more of a stretch in your abdominal region. And this lady here, lower trunk rotations. Get those hands above your head or at least out to your side and rotate to one side. All of these stretches, whether you're up on your elbows, back over a ball, or with your lower trunk rotation, we want to hold that for at least 2 minutes, if not longer. I have seen people online, some exercise physiologists said, oh, for adhesions, we want to bounce into them. No, do not bounce into the adhesion. What you're going to do is you're going to take that scar tissue where you're stretching and you're just going to pull it and you're going to hold and you're going to hold and you're going to hold. Do not take that stretch and move it. You're just going to hold that stretch for a good 2 to 5 minutes. And then slowly, if you're on your lower trunk rotation, go to the other side. Or if you're on the ball, slowly work your way down so it's now underneath your mid back and underneath your pelvis to slowly just keep working that scar tissue up. Okay, so Larry and Belinda. Clear Passage was started by Larry and Belinda Wern. Belinda, in her late 20s, had cervical cancer. And she was put in a hospital room, and there was a rod of radiation inserted into her vagina, and she laid in a hospital bed for 14 days. So we don't do it like that anymore. There's a lot of proton therapy and radiation therapy that's really, really specific. But back then, that's how they cured cervical cancer. And she was cured of cervical cancer, but it irradiated her entire pelvis. So within a very, very short time, she was having issues with chronic pain, frozen pelvis, bowel obstructions. She literally could not function. She had to quit work. And then what happened was she and Larry began this journey of taking different classes, incorporating different techniques, learning from this person here and saying, well, what if we do this, that, and the other thing? What if we work on it as scar tissue? What if we really take it and hold and hold and hold and hold? And Belinda became functional again. And Belinda is a physical therapist. Larry is works in property management. He graduated college with a English degree, and he curated fine arts museums, and he became a massage therapist. So together, after Belinda was feeling better, they were opened their own clinic, which eventually morphed into Clear Passage. Why they were treating originally, helping people with chronic pain, low back pain, their females were coming back to them and saying, hey, I am now pregnant. I was told I was never, ever, ever going to be pregnant because I had blocked fallopian tubes. Well, eventually a doctor at University of Florida, Dr. King, reached out to him and said, what are you doing? Because you are doing things with your hands and in therapy that I can't do during surgery. So that's when the research started, of the rate that we're opening blocked fallopian tubes, how well we're doing, that it's better than surgery. And eventually, as that research got put out there and they started treating more female infertility, somebody called them and said, if you can open up these little itty bitty tiny fallopian tubes, can you open up my digestive tract? I'm having bowel obstructions and I'm in the hospital at least every couple of months. And I keep having surgeries after surgeries. And so about 25 years ago is when they treated their first bowel obstruction. And that particular client has not been back in the hospital for a bowel obstruction. Thank you so much for attending. Feel free to reach out to Clear Passage, call us, email us, and we'll be more than willing to talk about what's going on in your life or your loved one's life to either point you in the direction of a good professional or to see if we could help you. Thank you, everybody. Have a good day.